we talked about what we were going to bring to the system, to St. Luke's, Cornwall, and to our region. So let me just name a few. Thoracic surgery, expanding critical care capabilities. We broadened our physical medicine reach, and we really enhanced our cardiac rehab, pulmonary rehab, by becoming partners with Burke Rehab Center. Our CEO from Burke, Jeff Menkes, and our partner from the system is here. And I will tell you, we're having a robust system right on the Cornwall campus. In addition, we are expanding our oncology program. And just last year, we welcomed a new medical director from radiation oncology, Dr. Kopowitz. So this is bringing a new level of care, because not only are we a part of the Montefiore Health System, we're also part of Albert Einstein School of Medicine. So what's that mean? That means right here in this region, we're going to have clinical trials, we'll have up-to-date research. Nothing a community hospital could have done on their own. So we're also connect our physicians, our patients to other communities, and this is just the tip of the iceberg. It really is just the tip of the iceberg. So together the possibilities are endless, what we can do for our community. Montefiore's mission: to heal, to teach, to discover, and to enhance the health of the communities we serve. This could not be more aligned than our mission. As we move ahead, we'll continue to build program services on both campuses. Together, we'll work with the Montefiore leadership team, our colleagues, and our partners throughout the region. Dr. Safier's philosophy is very simple. Keep the care local. He told us that 3 years ago, and he says that today. And what does that mean? We talk this word, clinical integration. So we have a medical staff that is second to none. So our medical staff takes care of this community. When there's a gap in service, or when we need to enhance our services, we do what we call clinical integration. Montefiore comes to us, and we've seen that. And I see some of my colleagues, my friends here today. You've seen your local doctors in the care, because we can't be all things to all people. We cannot do lung transplants here, nor will we ever. We cannot do open heart surgery. So at that point in time, we have our partners, White Plains Hospital, the mothership at Montefiore, or any place the physician directs the patient to go. But I will tell you, the beauty of Dr. Safier's philosophy is that let's keep the care local, because even if we go out for those services we don't provide here, we bring the care back for the aftercare. And that's been the history of the last several years. So you're a man here over regional strategy. So our commitment to transform the Cornwall campus to a population-focused outpatient center. We're going to do it. We're in the midst of doing it. We are currently renovating the physical plant of the Cornwall campus to provide enhanced space for physical therapy and cardiac rehab. With the support of the elected officials, we are committed to the concept of open access primary care, providing patients with ease of access to medical services that do not require the emergency room, that do not require urgent care. We've added a breast surgeon to our team, Dr. Veronica Ferenc, a Newburgh native who was raised and schooled here, came back here, and now she's a breast surgeon. It was a gap in our community. We've done that with our partners. As announced in November, the $8 million expansion to our Newburgh campus to expand the ED footprint. That is all happening under the leadership of Montefiore. Our community engagement efforts are stronger than ever, and we'll continue with community education. I'd like to thank just a few people who were instrumental to bringing us to this point. First of all, most of my board of trustees are here today. If the board could please stand, and my board of trustees that have been from prior years. I know I have past chairman, Doug Hovey is here, Pat Ortland, past chairman, and most of my board is here. I also have the foundation board here, led by Eric Najork. So, round of applause. So it started though back in 2013, and it started with very strong board leadership. Pat Ortland was chairman of the board at that point in time, and he said we can't do it alone. Community hospital, we cannot no longer do it alone. We need to seek a partner, and we started on the journey, and it continued with Michelle Ryder's leadership. And We chose Montefiore, Montefiore chose us. And this was the biggest transaction ever that occurred on the St. Luke's Cornwall Hospital. Well, who better than a woman who does transactions for a living? So Michelle Ryder, thank you for your leadership on that. Dr. Jeffrey Brackett. So I always say, so if you haven't been to Maris, Maris looks like Harvard. Maris is unbelievable, and Jeff is responsible for that. It is incredible, incredible, beautiful places. But he's not only a builder of buildings, he's a builder of people and strategy. And he said, Joan, let's forge on. We need to go. This is a good partnership. So thank you to the leadership of my current board and my 2 past boards. So thank you. Medical staff. And I see we have our anesthesiologist here. I see we have our cardiologist here. I see Joe Raccanelli, my good friend from radiology. I see, I don't want to name all, I see Dr. Jalalian, our past CMO. I see our current chief medical officer. David Harrison, our president of the medical staff. You're only brick and mortar without the medical staff. And then I see our boots on the ground. Our nurses, our transporters, our respiratory therapists. I see our cardiac cath lab, and I saw, where's my good friend who went through the cardiac cath lab? There he is, Lynn Warren. Lynn Warren, who at one point in time said he'd never stepped foot in St. Luke's Cornwall Hospital. He is now a standing advertisement for St. Luke's. So Lynn, executive team. They make me look good every single day. This is an executive team that is second to none, so thank you to the executive team. Thank you to my department managers and all my directors throughout the house. And I tout all the time that we are so much more than the brick and mortar. This is what we are this community. And I will tell you, there are many people that made this day happen. And I will tell you, I thank our elected officials. No one needs to have an introduction to Senator Bill Larkin. Senator Bill Larkin has been an incredible friend. If you see the heliport out there, Senator Bill Larkin had more patients come and leave this hospital through the generosity of the state through his leadership. So Senator Assemblyman Scartatos, he is chairing up at Albany today. Spoke to him yesterday. He really wanted to be here. But he is the chair of the council, but he sent his chief of staff. Steve, where are you, Steve? Thank you, Steve. And the Assemblyman has been a great friend to St. Luke's Cornwall Hospital. And tell him that I really appreciate his support. Assemblyman James Skoufis could not attend today, but also has been a great supporter of St. Luke's Cornwall Hospital. Congressman Maloney, if you saw the television last night, I'm sure a few people watched that. I saw the congressman up there in Washington. The sheriff, I spoke to the sheriff, Carl Du Bois. Carl Du Bois actually has laryngitis, so he could not come. I said, good thinking, Carl. He's married to a nurse, so I know he doesn't have the flu, but he did send one of his chief deputies, so thank you for coming. Tell the sheriff I appreciate his support. Our county executive. So I had dinner with the county executive on Saturday night with 600 of my favorite friends from the chamber. Where's Lynn Saccone? Great event, Lynn. Great event. So he's in Disney World with his family. However, he did send Harry Poor. Harry, I appreciate you being here, and I appreciate the county executive's support. So we have the elected officials. My point being is I could not name all of you. I can, because we have to get Dr. Safia back on the road by 2 o'clock this afternoon. But what I'm trying to say is our appreciation. Appreciation for our elected officials and all that you have done for St. Luke's Cornwall Hospital. Appreciation to my partners. So I have Dr. Hal Teitelbaum from Crystal Run. I have Linda Muller from Cornerstone. I have Amy Winchell from Access. I could go around this room. I have our superintendent who's also on the Board of Trustees, and I have our great philanthropist here, Mr. Kaplan. I could go right around this room and I could name every single one of you. But in the interest of time, I cannot. But we do not take for granted that we are more than just the brick and mortar. We are this community. And that, you know, the whole is better than the sum of its parts. And being part of Montefiore Health System is the best we could be. So with that, I turn it over to the chairman of the board, Jeff.
Thank you, Joan. I want to great day for the community and for the larger Mid-Hudson region and truly for New York State. I know I speak to start for my predecessors as chair of the board, and it's, I'm sure, obvious to everybody in this room, not only from this morning but from the daily interaction, that as board chair, the first thing that you realize at St. Luke's Cornwall is that you have a tiger by the tail, in all the good ways. And let's have a round of applause. So the couple of quick comments, I'll hand it over to Dr. Safer. This process obviously has been a long one, and it has really been the collective will of this community in large part, not only through the generosity of our benefactors, like Mr. Kaplan, our elected officials, like Senator Larkin, but everybody in this room who willed this into existence. The care providers, the patients who come back, who testify to the excellence that is on display every day and every night in this hospital. And as we engaged in this search for partner, we had several major health systems approach us for the opportunity to serve as an anchor in the Mid-Hudson region. I want everybody to understand that this is a very important geographical location for a number of reasons, but that's not the only thing, obviously. It's about the quality of care and the intricacy of the operation and the dedication to mission to the region that is of paramount importance. And when we sifted through the process and began to analyze what would be best for the community, which is our mission, it was very apparent to us that we were privileged to be speaking with Montefiore as a candidate for a partnership, and it was very early in that process that we realized there was a very similar DNA. And I think I don't want to speak for you, Dr. Sefer, but I know that when the team came up, there were things about Newburgh that immediately reminded them of the experience in the Bronx, and the critical engagement with the community, the dedication to quality of service, the principle of innovation woven into every element of the operations of the hospital, and grit, commitment, a discipline not to give up. Those are all intangible elements that we felt were so immediately on display in our interactions with Montefiore that we really hoped that this would be able to come to fruition. And I think it's a testament to those qualities on both institutions' parts that we are finally here today. And I'll close with this, just if you think about the historical mission and tagline of St. Luke's for many years, you know, we've pledged to be with you for life. And this morning is really about the continuation of that commitment, but with Montefiore's expertise and their breadth and their sheer ability to match what we want to do as a regional hospital, we can truly, as Montefiore says, do more. And we pledge to do that, and it's a privilege to serve as chair for this great organization, and I couldn't be happier. And I'd like to just once more give a round of applause for our CEO and hand it back over to you.
Thank you very much. It is with honor and a privilege that DA, Dave Hoofler. Thank you, Dave. Let me just say something about Dave Hoofler. No, truthfully, we were talking this morning at our Board of Trustees meeting about the opioid crisis. Not just nationwide, not just regionally, but right here in our community. And Dave, I cannot thank you and the sheriff and the county executive enough for the partnership you have done. Saw the front page of the record yesterday, 4 deaths over this weekend. Dave was involved in it, 5 deaths, and every single one of them. So Dave, hats off to you. We're going to keep working together, and I really mean that sincerely. Thank you.
Thank you.
So it is with great privilege and honor that I introduce Dr. Safia, who does not really require any introduction. Dr. Safia is a leader, in transforming health. And he really, he says at his meetings, and I'm at every single one of his meetings, and he says, you know, we need to try to keep the patients out of the hospital. And we really need to try to look at, instead of reacting to illness, let's prevent illness, and let's look at a population health model. And he really looks at wellness, and he looks at the scope of the organization, and he says, you know, how can we do it better? He raises the standard. It is with a great privilege that I introduce Dr. Stephen Montefiore.
Well, I gotta say, I'm rethinking something. This doing more. I like "we got grit." We'll give you acknowledgement, but I like it. Being from the Bronx in Brooklyn. Joan, what can I say? You were somebody that when I met you, it was very similar. I knew you got it, I know you get it, and I know you know what needs to be done. And we have worked seamlessly since then. It's really terrific. And Michelle, I do want to acknowledge the connection and the support and the mutual goals that we set, and I think exceeded. And if you can build Harvard on the Hudson, you can do anything. And Jeff, you know, I think it's the beginning of many good things, and things you're doing with Marist and other places that can be integrated into this, and we can get a lot done. Senator Larkin, I can now say that you're my favorite because there's nobody else here. No, you are my favorite. And you are a legend, and what you do in Albany is awesome, and what you do for this community is equally so. This is our northern front. This is a rural hospital. I mean, it really is, if you think about it. And rural hospitals, in my mind, have the same issues as urban hospitals. They're in just different settings. And we share the same values, we share the same approach to healthcare. We will work to do that and integrate what we do and what you do in a way that also will become even more seamless over time. I think that there's many people to thank, but I'm not going to be able to match you. But when you said the DA was here, I was going like, maybe I have to leave. Hold it, the DA's here. So I am so proud and happy, and I have to say that your values are our values. And I think Joan has it very clear and very concise. We have to keep people out of beds. We have to keep them out of the hospital. We have to keep them well. And as a country, we're not doing so well on that front. And as a country, we're not doing so well on that front just for poor people. The announcement of J.P. Morgan Chase, Amazon, and Warren Buffett this week, no one knows what it is, but everybody knows that it is addressing a shortfall in our economy and our country. Everybody is not happy with what healthcare costs. We spend $3.4 or $3.5 trillion a year on healthcare in this country, and I'm not counting the lack of taxes that we collect on work-based insurance. So it's maybe even higher in terms of impact. And if we do that and we don't get the outcomes that they get in countries in Europe that have similar profiles as our country, it's hard to argue that we're not exactly on the right path. Approaching 20% of the GDP doesn't work. And I'm not talking about, you know, big walls and larger and arming ourselves more. I think we have an amazing defense and abilities in this country already. But I am talking about education and other needs that come out of our economy. And if you're not focused on that, things begin to drift. And I think we get ourselves in trouble. So I believe that arguing with things is one thing, and we should. Describing our vision of healthcare is very important, and being concise and very forward about it. But what's most important is to show the way. So, in my opinion, Joan has it exactly right. You don't do lung transplants everywhere. We just did our 9th. I cannot tell, it took us 12 years to build that program. Find the right people, to have the infrastructure that we need, to get the expertise 24 hours, 7 days a week, to connect to Burke. And we're going to use Burke, from the South for our lung transplant program. But that doesn't happen overnight, right, Jeff? You have to build certain capabilities. To separate those twins that were followed by Sanjay Gupta on CNN, the second done at Montefiore, the 5th done by the same team, only 7 successful operations of that nature in the history of modern medicine. Took years of preparation. Took years of not just surgeons and plastic surgeons and others working on this, but innovation and how we modeled the system. Dr. Racine was in the room for 30 hours. He had to tell Sanjay Gupta that he wasn't, Sanjay Gupta was so excited he wanted to jump in and start doing surgery. And he was a neurosurgeon. This is teamwork. 30 hours with how many people in the room? 40, 50 at sometimes. That doesn't just happen. But that is not what we need for every human being. What we need is comprehensive care, and we're talking about that here. And we're showing the way. I want to shout out to Hal Teitelbaum, who is somebody who is also a visionary, and somebody who has built a marvelous network of care in the community. And how many years ago did we meet? How many conversations did we have? But we got there. And we have a partnership, and that partnership's part of this. So we continue to move down the path that we had carved out for ourselves. I'm sure there'll be many twists and turns. I think we will learn from what we do. Allison's here with DISRIP. There's a piece in Cranes today about the $3 billion that have gone into the community, and a bunch of money has come into this community via that vehicle, the Hudson Valley DISRIP program. I dare say that most of what we've done has been in the community, and not a lot of it has shifted to somewhere else where there was a shortfall. We've used it to do the right thing, and we will continue to do the right thing. So in conclusion, I will say that keep care local, yes, and provide care for all. Because there are people, and I go back to where I began, even with gold healthcare insurance at Goldman Sachs, that don't get the right healthcare. I mean, I have people on my board, and they call me up and they start telling me about the care they're given, and I'm going like, I can't believe this. And they were working for top companies in New York City with incredible gold-plated insurance, and it's confusing. They don't even know, they left a doctor's office, they don't know where to go. They go there and they don't have their records. They have to go back and be retooled. And then they go through a series, has this ever happened to anybody in this room? And then they call you from the insurance company, challenging you, and you don't even understand what they're saying. And you might graduate from Marist. I just think we need to lead the way. We need to change this healthcare system, and it's not just pontificating about it, it's actually doing it, and we will do it together. So, happy to be here, glad to be here, and my best to everybody in this room.